but I think we're ready to kick things off. Got that. So good morning, everyone. Welcome to the first day of the commission on paid family medical leave. I'm really excited to have everyone here. Up first, we're going to be doing introductions. I think to start, I will introduce my esteemed co-chair and then we'll go around.
Thank you. Thank you, Senator Daughtry. I am Kristen Cloutier, and I represent House District 60, which is part of my hometown in Lewiston, and I am the House co-chair of this commission.
Thank you, and good morning. I'm Senator Maddie Daughtry, and I represent Senate District 24, and I am the Senate co-chair. And let's sort of go around. Let's do the House members first, and then we'll introduce everyone else. So first, if Senator Stearns, and then, sorry, just gave you a promotion. Representative Stearns, and then Senator Rosen, if you guys can introduce yourselves, please.
Thank you, Maddie. My name's Paul Stearns. I represent House District 119, which is in the most rural sections of Piscataquis County.
Thank you. Senator Rosen.
Thank you very much. I'm Kimberly Rosen, Senate District 8. My district has 16 towns from Castine all the way up to Lincoln, plus the city of Brewer.
Thank you so much. I'm trying to think of the best way. The problem with Zoom is we're not all around a horseshoe, so you can't, lean to the left or to the right. Has everyone experienced, this is a little bit different, but just to get us, going popcorn style, which is you look for someone around after you introduce yourself and you say the next person. So look around the Zoom screen to see who hasn't been introduced. So I think we'll start with Charlie Mitchell, if you'd like to introduce yourself and then say your appointed role on the commission, and then pick someone else on the Zoom screen who hasn't gone, if that makes sense. And I think you're on mute, Charlie. It's not a proper Zoom meeting. Until someone's been muted.
Yeah, I work in the service industry. So Charlie Mitchell, I live in Gray. I run and own Bayside Bowl in Portland, Maine. And I will turn it over to Sarah Bryden.
Thanks, Charlie. My name's Sarah Bryden. I work for a software company called Majesco, and specifically I do leave of absence compliance work. I've been doing that since 2009, not all those years for Majesco, but currently my title is Senior Lead Compliance Analyst, but that's me. So let's see, I will pass this over to Emily.
Hi, I'm Emily Ingerson. I own and operate Ginger Hill Design and Build. So I'm a small business representative on the committee. And I will pass it to, is it Drew?
Yep. Hi, everyone. My name is Drew Christopher Joy. I'm the former director and currently the leadership development coordinator at the Southern Maine Worker Center. And I'm here as the sort of worker and independent contractor appointee. And Wendy, did you go?
Yeah, no, not yet. Thank you. Hi, I'm Wendy Estabrook. I'm the Director of HR Shared Services for LL Bean. And I will pass it to, there's B. Crowley. Have you introduced yourself yet? No.
No, I'm Barbara Crowley. I'm a pediatrician that worked in Augusta, Maine for 20 years and then was a senior administrator at Maine General Health. I currently oversee an endowment program that we have. I'm here as a governor appointee with an understanding of what the impact can be for postpartum moms and early childhood. So great to be here. Now let me look and see. Laura, you haven't introduced yourself.
I am not. It's good seeing you, Dr. Crowley. Laura Fortman. I am the commissioner of the Maine Department of Labor, and the department has a seat on this board, and I decided that I would love to be my own designee on this commission. So I'm delighted to be here. And I can't tell if everyone has been introduced or not? If someone has not been introduced yet, could you just raise your hand?
I think, yeah, Benita.
Ah,
It is correct. Oh, I think you're on mute. There you go. You're good.
Okay, yeah. I'm Benita Usher. I live in Buxton. I own Smooth Transitions Maine, so I help seniors transition from their homes to assisted living or an Alzheimer's and help their families. I'm a governor appointee, so I'm very interested in seeing this project through. Don't know if there's anyone else. I can't see. Do you see?
I think that's everything. It's time for one of our most important introductions, our esteemed and incredible OPLA staff. So Anna and Colleen, if you'd like to introduce yourselves.
Hi. Sorry, I'm just having trouble with the mute button myself. I'm Anna Broom. I'm one of the staff in the Nonpartisan Office of Policy and Legal Analysis. During session, I staff the Health and Human Services Committee, or co-staff it.
Good morning. I'm Colleen McCarthy-Reed. I'm also work with Anna in the Office of Policy and Legal Analysis. And during the legislative session, I staff the Health Coverage, Insurance, and Financial Services Committee. And I also assist with the Labor and Housing Committee. And this legislation to establish the commission came out of the Labor and Housing Committee. And I worked with them on this bill and previous bills related to this issue.
Thank you so much. And just to let everyone know who's either watching on YouTube or listening to the audio stream, and a reminder for all of us, this is being streamed live and is accessible to the public. Also, if anyone is looking at our agenda, we will be moving a few things around in interest of folks' times constraints. We're actually going to be moving, after our next session, we'll be moving the commissioner's portion up since she has a prior commitment. But before we jump into reviewing the resolve, I just want to say I'm so excited to be here. And I want to thank all of you from the bottom of my heart for being willing to serve on this commission. We'll get a little bit into all of our personal stories a little bit later in the agenda. But for me, this is something when I first got elected as a little bit wet behind the ears, 25-year-old state representative, this was one of the first things I wanted to work on. And to be at this point is something that's, very moving and very exciting for me. And I can't imagine a better team to be doing this with. And I don't know, Representative Cloutier, do you have anything you'd like to say before we kick it off?
I would just add that, and we'll get into this, I think, when we do our sort of round robin, but this is just a really deeply personal thing for me. And so I'm really just honored to be here and so thankful to be here with all of you.
Agreed. And with that, let's get things going. We have a large charge in front of us, so let's make the use of all the time that we have. So with that, let's move on to the review of the resolve and our commission timeline.
Okay, so I'm going to share my screen, hopefully successfully. You can all see that, correct? The resolve. Somebody will tell me if you can't see it, I hope. So I'm not going to go through most of this because it's not really necessary. I'm going to charge down through the commission membership because you've all just introduced yourselves and go to the duties. I do just want to remind you that this was a bill that did not have an emergency preamble on it, which is why you couldn't start until the late October. So with that, I'm just going to go through the duties because that's the main thing and the sort of timing and the staffing. I won't be the one that's going to hold you up here, I promise. So you can see that the duties here are to study the program, the paid family and medical leave benefits programs in other states. And yeah, in that review, the commission is going to consider the equity of the program, how the program is funded, state partnerships and consortiums, including IT needs, education and outreach, oversight and structure of the programs, and the relationship between state government and the employers and the employees participating in the program. So that's the first part, looking at other states. Then secondly, and I know there was a question about this earlier, that you will solicit and consider public comment on the establishing a paid family and medical leave benefits program, including but not limited to purposes for the leave, the eligibility, job protection and duration. And today we're just having a sort of introductory meeting with members of the commission having the discussion, but there will be plenty of opportunity, as my understanding, for public comment as the commission goes through its work. Third, to develop a plan to implement a program by consulting with other states. And then fourth, and this is a big one, is contracting and completing an actuarial study that would look at whatever program you've decided to look at, to include the startup costs, the ongoing costs of the program, the economic impact on and benefits to the state, and the contributions that are needed to maintain the solvency of the program. And then once you've had that actuarial study, you'll make recommendations to implement a program to the Labour Committee including with any necessary legislation. So then the staffing, this is slightly unusual, partly because you do have the actuarial study in there, but the study is staffed by the Legislative Council, which in this case is OPLA, so Colleen and I will be staffing it. But you also can contract for, I'm sorry, any additional staffing. We also are not allowed to staff during session. So whatever work you don't complete by the beginning of January, you'll need to have a conversation about how you'll continue to staff the study. And you can see there that upon request that the Governor's Office of Policy Innovation in the Future, Department of Labour, Department of Health and Human Services, Administrative and Financial Services, OIT, and Bureau of Revenue Services can also provide additional staffing assistance to the Commission. Then your report to the legislature is due on February 1st of 2022. So you can see there will be some likely possible issues there with how you want to complete the task and the staffing, as well as the actuarial study. I'm going to skip over 8 for now, but you can also see there in sections 9 and 10 that there is a $200,000 allocation for funding to complete the actuarial study by a third party. So there is funding available for that, and perhaps for any additional staffing as well. So you do have a little bit of a challenge in terms of figuring out how to complete that work, including an actuarial study by February. So that will be something for you all to think about as time goes on. And the only other thing I wanted to mention is that you are approved for, at the moment, for 6 meetings of the Commission, so that you do have some time there, but it's unusual in the sense that you do have to figure out how to fit in what you decide to do, then have the actuarial study, then it have come back to you, and do all of that by February 1st.
Thank you, Anna. And as everyone can see from that, we do have a pretty tight timeline, but I'm confident in our ability to really, dive into this and, move the ball forward. With that, any questions on the duties of the timelines or anything on the resolve? And I should say, for those, in the Zoom format, if you can use the reactions to raise your hand, there's a raise hand option, but if you can't get it to work, don't worry, just raise your hand physically and I'll keep an eye out for it. So Benita, I saw that you have your hand up.
I do. So I understand that this is a study, but my question is, back in one of those statements that Anna just went through, it sort of said that this is going to take place. So I just have a question about that. this is a study, correct? We're not definitely charged with making this happen until we know what the bottom line is, correct?
That's sort of the rub of the whole process, is to figure out what best suits the needs of Maine. So our charge as a study is to really look at what the gaps are, if this is possible, who it would cover, how it would cover, and start that foundation, that outline, to really come up with the ideas. And then if we're at the position to be able to turn around, part of our charge is using the actuarial study to figure out the sort of, where the rubber hits the sand of what the cost would be, and what the concrete requirements would be for it to come forward. So hopefully that answers your question. I do think, just speaking for myself, what is exciting about this process is so often, and we're about to jump into the reviews of other states, Maine isn't like Washington or Massachusetts, and this gives us a chance to really delve into what we need to make happen for this program to work for Maine. Our demographics are different, our state is different, so it sort of gives us this opportunity to craft something by Mainers for Mainers. Hopefully that helps. Any other questions on that? Not seeing any. The one last thing I will say, hopefully, thinking about it, is that so often a lot in policy work is, we come up with the ideas and we deal with, the ramifications later. I think one of the nice things about this commission is that we do have the ability to get that actuarial study done to see what it looks like in practice. So I think it's a pretty powerful tool we have at our disposal. With that, we are going to be switching around the agenda. We're going to be swapping items 3 and 4. So I think if we could start with the paid family medical leave programs in other states and jump into the background materials, and then we'll be having Commissioner Fortman jumping in and giving us her feedback as well.
Great. Okay, this is my part. So I'm going to share my screen here. I think everybody can see that. We had shared some charts and materials from other states, but thought it would be helpful to kind of put together a few slides, just high level for you, and some links to additional resources. As Anna said, we kind of got a late start, but then a quick start in terms of pulling together the plans for this first meeting. So we hope to be able to share with you any additional information and delve more deeply into any particular other state programs as you move forward. But this is really just intended to give you sort of a jumping off point and the resources that you might need to sort of learn more. And Anna and I are available to provide any additional information that might be helpful to you. But generally, currently, there are 9 states in the District of Columbia that have enacted laws to establish family and medical leave programs. And I listed for you those 9 states and Washington, D.C. Some programs have been operating longer than others. And there are 3 states on that list, Colorado, Connecticut, and Oregon, that have enacted their legislation and are on their sort of timeline towards implementation, but those programs are not yet providing benefit payments to eligible individuals. So they're still on the sort of the continuum of implementation in those 3 states. The laws do vary in each state, and if you had a chance to take a look at the charts that we provided, you can see that really, as Senator Daughtry mentioned, I think every state has made different decisions about how they want their program to be established and implemented. So there really are some commonalities, but there are some key differences if you look at other state laws, and I think you'll be discussing that more as you move forward. But we did list here for you some of the key components. I think some of the key questions that as you move forward, you might want to think about in the development or of a paid family and medical leave program for Maine. What are the purposes of the leave? Who would be covered? Public and private employers and employees. Could you provide this option for those who are self-employed? What are the eligibility requirements to qualify for leave? how family is defined under the statute, how much paid leave is provided, any maximum benefits on a weekly basis, the length of the leave, any sort of distinction between paid leave for to take time off to care for oneself, or paid leave to take time off to care for members of a person's family. Any job protection provisions, the availability of private plans, and the ability of a state program to be developed sort of as a public-private partnership, if you will. And then, certainly funding and a timeline for implementation are some of your key questions. As I mentioned, we did provide for you a couple of charts. One was a chart that was prepared by our OPLA staff that sort of outlines each program. And what I think is helpful about this chart is it provides links to all of the legislation for each state. So if you want to delve more deeply into that, that information is available for you. Let's see. The other chart that we provided, which I think is useful for comparison purposes, is the chart that was prepared by A Better Balance, which is a nonprofit advocacy organization. But what we liked about this chart is it provides sort of a comparison of each state's laws and kind of uses some of those key questions I identified. The first page, you'll see what purposes can the leave be used for, and it sort of identifies in each state what decisions they made with regard to that question. So I think that chart is also useful to you as you kind of move forward and educate yourself about other state laws. I'm going to share again because I got off my screen, so I apologize for that. And then the last thing I just wanted to mention is this last slide here, which provides some additional resources. And there are a ton of other resources out there on paid family leave, but we identified just a few of them to give you a sense of the issues. The National Conference on State Legislatures has a webpage with a lot of different links to issues related to sort of other state legislative activity, and then some background information about sort of the interplay between, and we'll talk about this more, I'm sure, between the current federal statute, which governs unpaid leave, and how state paid leave statutes work within the context of the federal legislation. And then there are some different reports that have been done fairly recently by different organizations about paid family leave, taking a look at the other state legislation. So hopefully that's helpful to you, sort of a high level about what other states are doing. And I know Commissioner Fortman is going to talk to you a little bit more about sort of her experience and some discussions she had in the last few years about the Washington State experience in developing their program. So I'm happy to answer any questions. And as you move forward, if there are any more particular details that you want us to delve into, Anna and I are available to do that for you.
So much, Colleen. Do we have any questions on that? Seeing none, I think we'll pass it over to the commissioner.
Thank you, Senator. And Colleen, thank you for agreeing to share the slides. So first of all, I do want to say this information was pulled together rather quickly, as we've already heard. We've got a tight timeline, and I think Colleen reached out to me on Wednesday and asked for all the conversations that I've had recently with states on paid medical leave. And I was very upfront, and I said, I've been a little preoccupied with some other things over the last 2 years. And so I have not had an in-depth conversation with any other states on paid leave since the fall of 2019. However, I did reach out to my colleagues in Washington State to try to get an update. So the information that I'm presenting is not in any way an endorsement by the Department of Labor about anything that I'm going to say, merely reflects conversations I've had and what I know about the situation in the state of Washington. Next slide, please. So one of the reasons that we were very interested in Washington State and their paid leave program is because Washington State was the first state in the country to create a paid leave program from scratch. Up until that point, every other paid family medical leave program was built on an existing state temporary disability insurance program. And here's just a quick timeline about how they proceeded in Washington State. They had legislation that was passed in July of 2017, and then they launched their benefits in January of 2020. What is not reflected in this slide, though, is that the state had been doing work on paid family leave since at least 2007, when they had various starts and stops and research that was done. In their first month, when they opened the program, there were 30,000 applications. Next slide. They convened a meeting of states back in the fall of 2019. I participated, several others from Maine also participated, just to get a sense of how were they approaching this. They were ramping up. What were they thinking about? What were their key learnings? And for them, they were really trying to create a brand new culture about how these services were going to be delivered, with a very clear emphasis on change management. They dedicated a full-time staff person to be their organizational change manager. It was visiting their space, because I did go out there. It was very, very dynamic. They created from the bottom up a culture that was really invested in implementing these services, putting customers at the center, doing a clear outreach to both businesses and workers, and adapting to any input that they were receiving from both of those customers. They were using lean as a model, as well as agile development systems as part of their values and principles. They were invested in continuous improvement. So these are some of their core values, which is not usually how we talk about things, or at least that has not been my experience. But seeing how they were delivering this and how quickly they were able to do it, this is a foundation that their program is built on. Next slide, please. They did not try to take an existing agency and just repurpose it. And I think that's why the Department of Labor has frequently been pulled into these paid family medical leave conversations, because on the surface, it looks like the delivery of unemployment insurance and paid family leave are very similar. And there are some components that are similar. And so while this program is housed in the Department of Labor, there is in Washington State, it is an entirely separate group of people who are working on the paid family leave program, and they built that group from the bottom up. They currently have 243 employees, and they have a hiring request in for an additional 143 staff members. That was information from yesterday. So that piece is based on current numbers. Their team, they've integrated agency staff, vendor staff, and consultants who work side by side in delivering this program. They were able to do their startup by an $82 million loan that the legislature, through, I'm not sure of their exact process, was able to give the agency for startup costs. And then they paid that loan back prior to the first benefit payouts. Their funding mechanism includes premiums paid by both workers and employers. Next slide. Their initial technology costs were about $57 million. One of the things, and I think Senator Daughtry said, Maine is very different from Washington State. Their agency is surrounded by a talent pool working for Microsoft and other high-tech vendors. So the people they were able to pull from and to implement this had deep experience with technology, and they built on that experience. We had estimated costs. These costs in here that we estimated for MDOL were the result of a request from the Housing and the Labor and Housing Committee 2 years ago about a rough estimate from us about what it would cost us to implement it. We have not revised these numbers, re-looked at these numbers or anything. These were numbers that we provided to the committee back in 2019. Washington State estimated that they need roughly 60 to 70% of their unemployment insurance team. They need to replicate that in order to deliver these new paid leave programs. And we estimated that if we were doing that, we would need roughly 115 positions. And that's because you need a revenue, so there would be some sort of an assessment and a collection of revenue as well as a benefit payout. Again, this is all hypothetical. All of those questions about who's covered, how is it delivered, all of those things would need to be determined before anyone could come up with real numbers. These estimates are just based on, if we had a system similar to what Washington does, what would it take to deliver that kind of system here in our state? Any funding would need to be completely separate from the unemployment insurance fund, because none of those resources resources have strict guidelines about how they can be used. So again, these numbers were developed in 2019. They were as accurate as they could be then. We would need to look at what the request was and revise those numbers. And then on the last page here, I also included, this is all Washington State specific information that's available on their website so that people could go in, look at reports that they have done. The folks in Washington are happy to provide additional information if any is requested. So thank you.
Thank you, Commissioner. Do we have any questions for the Commissioner or any more information? Representative Cloutier.
Thanks, Senator Daughtry, and thank you, Commissioner Fortman. So in your presentation, you had said that there were startup costs in Washington of about 82 million, and then there was 57 million for IT. And I'm just wondering if that 57 million was included in the 82. So the majority of the funding really was IT costs.
And that, yes, and that's what we were assuming would be our startup costs as well. And one of the things that we were looking at, Representative Cloutier, was the unemployment insurance technology system had been revamped in 2017, and those costs were roughly $90 million for those technology costs.
Great, thank you.
Ms. Bryden?
Thank you, Senator Daughtry. Commissioner Fortman, I'm curious if in your conversations with the folks in Washington, if they were able to share any perspectives on challenges that they faced, things that they wish they had known when they started. If anything's coming to mind, I hope that you could maybe share some of that.
Again, reaching back, that was not what they highlighted. I think they stressed the strengths. And for them, that strength really was using lean and agile principles and being willing to, pivot quickly when they ran into roadblocks rather than saying that they needed to just kind of stay the course. So they were very adaptable and they continue that kind of core principle. So, which was, I don't want to say that it was particularly unique, but it is not a mindset that is easy to transfer into government.
Mm-hmm. Thank you.
So I have next Ms. Crowley. Is that how you say your last name? Am I pronouncing that correctly? Oh, you're on mute. Oh, hold on 1 second. Let me see if I can get you to unmute. You should see a button to let you unmute.
Sorry.
No worries.
Yes, it's Crowley, and I will change my tag so you can see that it's Barbara Crowley. I guess one of the thoughts I'm going to have throughout this is to make sure that we can make whatever we suggest as simple and straightforward for the consumer, the family and the consumer and the employers. And Washington had that as a principle up front, at least as you presented it, Laura. Do you have any information? And I think as we look at some of the other states, we're going to need to understand this about how successful they might have been in the simplicity or what the feel was like from the individuals receiving the benefit. But you're on mute.
Yeah, Dr. Crowley, I again, we can ask them. But they did a lot of work ahead of time. You know, the dates that are on there are their most recent effort. There were efforts that took, one of the things that I remember, and my memory may not be completely accurate, but when they started on this in 2007 and were not successful in, completing the entire project and getting a program up and running, they spent a lot of time bringing together businesses and worker advocates. And they also had a study that they were able to do with the US Department of Labor's Women's Bureau to do an analysis. So even though they had a 30-month, roughly, time from when this most recent legislation passed and they implemented it, there was a lot of work that had been done ahead of time, and both business and worker advocates had already spent lots of time in communication and in discussion prior to the announcement of this. But I don't know what's happened. There are other states that have gone online since then. There are other lessons that we should be looking at. We went to Washington because they were the first who did not have a TDI program, and Maine doesn't have a temporary disability program.
Thank you, Commissioner. I think I saw Ms. Usher's hand up, followed by Ms. Ingerson.
Thank you. Commissioner, I was just curious, the bulk of the initial money seemed to go to the technology. So once that initial technology is purchased, how fast do you think that that's going to go down for the following years? And the other question I have is, Washington State has a population of 7.6 million versus our 1.3 million. I'm just wondering about those figures and how you think that's going to help or not help.
I think those are all excellent questions. And I think that's part of what this commission needs to kind of sort through. This was not work that we did. We were gathering information. A couple of things that I do want to say is that one of the principles in Washington was that there was continuous improvement, that it was not just, okay, here's an upfront technology cost, that's taken care of, we don't need to worry about it. I think that's, and I'll talk from unemployment experience, is that you cannot just purchase technology. You have to constantly modify it, build in what you're learning and adapt. Otherwise, it will become obsolete fairly quickly. Washington State has their vendors, or at least 2 years ago, had their vendors sitting side by side with staff to deliver these programs and to adapt and innovate as they were moving forward. So while the upfront cost would be I would guess, would continue to be the most expensive, there would be ongoing costs that should be built into it. And then the other piece of it is that you need staff to deliver the services. So there's going to be, and I don't know what it would be in Maine, but a certain level of ongoing staff support that would probably require, a significant investment.
Thank you, Commissioner. I had Ms. Ingerson. Hopefully I'm saying your name correct.
Yeah, that's fine. Thank you. So just a question, I know, you kind of just got an overview from Washington on their program, but I'm wondering if you have any information regarding their participation rates. I know you said in the first month they had 30,000 people apply for coverage, but do you know kind of like what the average participation has been?
I don't. I would, I think, again, this was a request made 2 days ago. So this is not something that I have been working on in any way, shape, or form for the last 2 years. I think we could request that information from Washington. I also attached the most recent reports that we could find, and some of that information may be in those reports.
Thank you, Commissioner. This is a good reminder, since we are starting so fast, if there's questions we can't answer, please let us know. Even if you're, it's in between meetings and you wake up in the middle of the night and you have, I need X, Y, and Z, please email us, Colleen and Anna and the Commissioner, and all of us can work to try to get that information. And that's going to be a key part of the process. So definitely have a pen handy and make sure you get all those questions down so we can get as much information as possible. Ms. Esbrook?
Thank you. Well, first I would just say, I think we're in such a fortunate position to have the experience of those states who've gone before us. I know that at LL Bean, we actually interact with a number of these states and the programs are working very smoothly. So my question goes back to the technology, and do we feel like we have the foundational system in the state that we could use to build this out? Or would we be going through an RFP process and looking for a new vendor?
I'm not aware of any system that we would be building on. I think that this, but I don't know. That could be another question for this commission.
Right. And obviously, again, we'll have the benefit of seeing what system the other states are using and how that's working. Thank you.
Absolutely. Thank you. Drew? And correct me, is it Drew Christopher or Drew or?
It's Drew Christopher, but Drew is fine. Thank you. Yeah, I just wanted to say, I've thought a lot about this issue in relationship to workers and not necessarily a lot in terms of how it gets implemented in staff. So this is an interesting conversation. And I just think that one thing that feels exciting about what you're reporting out from Washington is the sort of like robust staffing and building a program that actually works to provide the service that it's intended to provide. And I think, especially over the last year as an advocate for workers and as an organization that has done support for workers, particularly around the unemployment issue. I think my experience and the experience of a lot of people who were engaged in that is that the unemployment system in Maine is is understaffed and needs more funding. And, I think there's lots of other places that the Department of Labor is understaffed, and we should be, as a state, prioritizing giving that department the support that it needs to do its job. But it feels exciting to me to be thinking about how we build a program from the ground up, so that it actually meets the needs of the program, so that it actually serves workers and the businesses that are part of it well. And so I just feel excited about that as a way for us to go into how we think about this, and the sort of culture in Washington around people who are really committed to building a project that is going to work well for people. It just feels exciting, and I just wanted to flag that seems like a good mentality for us to be bringing into this, and hopefully demonstrating to other people as we report out from this work.
Absolutely. And it's a good reminder of just looking at the different states and seeing how they were built. And, as the commissioner mentioned, many have been built off of a TDI system, and, that's not necessarily something that we have the framework for here in Maine. So I think sort of getting back to what Wendy was saying, being able and, looking at the examples in front of us, we have this really excellent opportunity to look and see how it's worked in other areas and really how to create a robust program and learn from all of that. Do I have any other questions for the commissioner? Let's see. Benita?
May I just say that if I had been Commissioner Fortman during this last 2 years, I would have run away so fast, no one would ever have caught up with me. So kudos for her for sticking in there, doing a fabulous job. I just want to say she needs all the credit. Thank you.
It's actually, I appreciate that, but it's the incredible staff that we have here at the Department of Labor who deserve the credit. But I appreciate it. I'll pass that along.
Thank you. Okay, any other questions for the commissioner? Going once, going twice. I don't know if you can say sold on that one. Thank you so much, Commissioner. And I really look forward to working on this together. And it's very insightful to sort of have a good snapshot of another state's process before we really jump in. I think next we'll be transitioning, looking on the agenda to all of us. My co-chair and I, when we were talking about our first meeting and some of the important things, and I think this really sort of ties back to what the commissioner was just sort of talking about how Washington sort of built on these, key values and principles. And I think before we, get waylaid by thinking about costs or staffing and all of those very, large items, I think the top line all of us really need to bring into this process. And I guess sort of the homework for all of us to not only discuss today, but to try to keep in mind is, our personal narratives and the narratives of all of those around us, because there's a reason everyone on this commission is here today. We all either know someone who would have had their life completely changed by access to this, or we're lucky enough to have it through an employer. And I think that's really what we wanted to sort of set the stage and really get the ball moving, of sort of thinking about, what our own experiences are and sort of using that as one of our different lenses to really, get it going forward and, sort of keep those as our, principles going through this process. And so we sent out some questions. I think we can sort of, in the interest of time, if it doesn't go right in order, I just sort of, Morphus, feel free to jump around to the different ones. But, we're wondering if you've ever had access to paid family medical leave. From your personal experience, when would paid family medical leave have made a difference and how? And, in your head, it's okay if you don't have the answer to this. This is something we're going to keep thinking about and keep going back to is, what should a paid family medical leave program look like? And what elements do you feel are important? That one's probably a little bit more of a higher level one. So I don't know everyone's comfort level. I know it's been a quick turnaround. So maybe we just more focus on the first two questions and maybe come back to the third one a little bit later. But yeah, just sort of wanted to open the stage. I don't know, not to put you on the spot, Representative Cloutier, but I don't know if you would mind, sharing a little bit of your story or some of your thoughts on the first two questions.
Sure. So can you just read the questions for me again? I was responding to Drew Christopher's comment.
No worries. So I'd say the first two ones to jump into is, have you ever had access to paid family medical leave? And from your own personal experience, when would have access to paid family medical leave made a difference, and sort of how?
Okay, so yeah, some of you on this call may have heard me tell this story before. So my mom was diagnosed with Alzheimer's. I believe it was in 2014, but I really am lucky to know what year we are in right now. And passed away in 2018. And so she had been living on her own in Florida, and we had moved her back up to Maine. And between the time that she received her diagnosis and the time that she needed to be sort of in a home under, full 24-hour care, she was living with us and going back and forth between our home and my sister's. And my husband and I provided, family caregiving services during that time. And it was probably one of the most rewarding, but also one of the most difficult times in my life. We have a 13-year-old daughter who was obviously younger than that then. And, I have a couple of jobs, including this one, and my husband does as well. And when we had to make the decision to put her into a home to receive 24-hour care, every day of my life, I kind of think about what that meant to the acceleration of her illness. And I really believe that if we had had the ability to keep her in our home for longer, that it would have prolonged her life significantly. There was an absolute decline when we had to make that decision. And so I just feel like that is a really, I don't want other people to have to think about that every day of their lives. It was a really difficult decision. People having to choose, I think, between caring for a family member and being able to, pay their bills and keep their home and put food on their table. It doesn't really feel like a decision that folks in a place like the US and the state of Maine should have to do. So for us, I was lucky enough to have a really flexible employer and who allowed me to use sort of my sick time to be able to provide those caretaking duties for my mom. But I know that folks who aren't in sort of professional positions like I am don't have access to that. And so the lack of equity, I guess, in the current way that we're doing things is pretty significant. So yeah, I think that answers both of those questions. And I'm wondering if we want to allow Representative Stearns to go next since he has to leave early. Not to put you on the spot, sir.
But we're putting you on the spot, Representative Stearns, if that's okay.
I've always hated that teacher that would pick on me when I was sitting in the back of the classroom minding my own business, but I do appreciate it, Representative. I'm intrigued by the entire thing. I've always taught school since college, and teachers, due to the collective bargaining agreement, have always had the luxury, if you will, or the ability to have some type of paid time off that's been adjusted over the last 40 years with collective bargaining agreements. But in my role as a superintendent of schools, I would often sit at the bargaining table, particularly with hourly personnel who were treated a bit differently than the professional staff, and still are today. And to then go back into the boardroom with the members of the collective bargaining group from the school board, and hear many of them working in the private sector saying, wait a minute, we don't have any of that out where we are. Why on earth should those people have that? So I think in a roundabout way, I'm saying the same thing that the representative is saying, that some of the things that professional groups take for granted uh, non-professional positions, if you will, have no idea that that type of thing exists. So I'm really interested in the cost, the productivity gains, or possibilities. And I'm also a little skeptical about rushing into anything. So maybe my role will be as anchor.
Sounds excellent to me. And thank you very much, Representative Stearns. Would anyone else like to go? It does remind me a little bit of the class from Representative Stearns. For those who don't know, Representative Stearns and I served together in education. So if we use too many education analogies or start, using classroom management, that's where that comes from. I'm happy to share my own story. For me, there's been several times that this would have made a huge difference in my life. I have never had access to paid family medical leave outside of the legislature, where it is not an option for us. I'm self-employed. Since I, graduated college and wanted to move back to Maine, I've worked 3-4 different jobs. I started my own photography company, which definitely didn't have the option of paid family medical leave, and was one of the reasons I got really passionate about this when I first got elected. Because at that point, I was looking at, my parents who are getting older and wanting to be able to care for them, and just facing the reality of, this is something that might not be feasible for me if I stay on this, career path. And now, outside of the legislature, I'm the co-owner and brewer at a brewery here in Brunswick that I run with my partner called Moderation. We have a small staff. One of our core values is wanting to try to be able to save to offer this type of program. And I can tell you, of being a small local business, we've only been around 3 years. It's something that's really hard, but it's also something we see as a key recruitment technique. And if it's something we could offer to our employees, it would really make a difference in a really difficult labor market, especially in sort of the service and hospitality industry, which is getting ravaged right now. Another time it would have really made a difference for me is I actually got hit by a car a few years ago. And when I was on my bike and had to recover, it was a process. I was really lucky, sort of like Representative Cloutier was saying, that I had a really incredible employer in one of my 3 to 4 jobs who really helped make a difference and made it financially feasible for me to heal. But, it took a, large chunk of money, and I went into debt to be able to, go through that recovery. And then I think for me, one of the reasons it feels even more dire when we're discussing this, and, I agree, I don't want to rush into anything, but I think the pandemic has made it clear that we need to really put our nose to the grindstone and get this work done, is seeing how many of my constituents have really suffered to be able to figure out how to take time off during the pandemic. If they have the unfortunate matter of having a family member who's gotten ill, how do they balance that need of having to choose between their employment? We're seeing an astronomical amount of women drop out of the labor force to become, primary caregivers, not only for, their children, but oftentimes for their parents as well. And then for me, just to be honest, I want to have kids. I really want to be able to access, family leave to be able to start a family. And this is something that's my friends and I, we even had a conversation about this yesterday. Some of my friends would love to come back to Maine, but are literally staying in jobs where they have paid family medical leave, or going to one of the 9 states that we discussed, so that can literally afford to start a family. And so I can tell you from, the Brunswick High School class of 2005, there's about 20 of my friends who'd love to come back. And this is one of those key policies that they're looking for. So that's a little bit about me and what drives me to be so passionate here about that. And there's a lot more pieces as well, but happy to open it up to anyone else as well. I don't know, Charlie, not to put you on the spot, but I'd love to hear a little bit, knowing that you're also in the service and hospitality industry.
Yeah, and I'm serving that role as a representative from the hospitality industry, and I come at it from that rather than a more direct, connection to family medical leave. I've been certainly privileged enough to run my own place. So I have a 5-year-old and a 2-year-old, and I've been able to take the time I needed. My staff, we were up to 56 employees before the pandemic hit, and went down to 2, and have been slowly rebuilding. And other than that little window of time, I do have 5 or 6 of my staff have been with me all 11 years. The average time of a stay here at Bayside is about 7 or 8 years. And so we have a very tight knit family, and many of my staff who've started with me have had families. And I mean, certainly it's been kind of, we make up the policy as we go here. Honestly, I mean, there's unlimited unpaid, certainly, because we're taking care of everyone, and we try to find certain, jobs that folks can do at home and things just to keep people paid, as much as possible. I mean, the service industry is a little different because you do have redundancy in staffing. So there's certainly easy enough from an employer standpoint to cover positions, unlike maybe in a more, a skilled position. But, I mean, the service industry does have, I mean, certainly over the last few months, we've all been reading about concerns of working conditions, and we're very proud of how employment works at Bayside Bowl, and to see more of that within the service industry. I'm very happy to sort of be a part of developing a program so that we're not just sort of making up the policy as we go, and then there is help, and that, it's not coming up with, one-time payments. It's a system, and it helps my employees, continue to work here.
Thank you. And Wendy?
Thank you. Well, the story that I would share related to this topic is not my own personal story, but one of someone who I'm very close to, who is currently going through a situation where his wife has been diagnosed very suddenly with stage 4 cancer. This is a person who works also in the service industry as a frontline employee, and has now been faced with all sorts of challenges and choices about being able to care for his spouse while trying to go to work in order to make sure that they can pay the rent and all of their bills. Their first medical bill in the hospital for the first hospital stay, the first couple of days, was something like $38,000. This is obviously money that they don't have. Thankfully, they do have insurance, but like so many people who are working on the front line, thankfully he does have insurance. But when it comes to taking unpaid leave, that becomes untenable so quickly. So I think having some kind of support would make all of the difference for the two of them. And unfortunately, his wife has now had to be placed in a care facility because he cannot take care of her at home. But this really, this kind of story is not unusual. People face unexpected illnesses all the time. And as I said, with our company, we work in 19 states. So a number of the states where we operate do offer paid leave for employees. And it seems to be working really beautifully and seamlessly. So I'm really optimistic that we can come to a nice solution for the state of Maine.
Thank you so much for sharing. And that's unfortunately cancer. Yeah, I don't even have the right words, but thank you for sharing that story. And it is a really tragic situation when you're having to make those decisions for a loved one. And on the optimistic note, it is interesting to hear from the employer perspective of, interfacing with those other states, and hearing how it's working is music to my ears. So thank you for that as well. Would anyone else like to share? Or I can go back to the class. Ms. Ingerson?
Yeah, so my kind of personal connection with this issue is, mostly related to starting a family. So when I had my first daughter, I was employed in sort of an entry-level position at a nonprofit, and I had access to, short-term disability insurance that I paid the premiums for. And I had, 6 weeks of leave at 2/3 pay, which wasn't enough, but it was helpful. And then when I had my second daughter, I was self-employed, running our company along with my husband. So we're both having a kid and we're both running a business. And I didn't have any access to leave at all, of course. So after I had my second daughter, we had an 18-month-old and a newborn, and I went right back to work. I mean, I had to tote the newborn around to the job sites with me. And, I was also nursing her, which was a big challenge. I think, the actual recovery and the physicality of giving birth and lactation and all of that kind of those issues need to be kind of thought about as well, because that was a pretty big challenge for me personally, and I know for lots of other parents that I know. But yeah, not having the ability to take really any time off after my second daughter was really challenging. Working in a field where I had to be on job sites and I had to be, kind of out in the world. It was just completely exhausting. I don't even really remember that time period. So I think, it's important for a broad range of perspectives. And I've actually given quite a lot of thought to what a program should look like. And I would love to kind of get into that today if we have time, because I think it's important to kind of start with those baseline principles from the get-go. And it's been really helpful to see like what other states are doing and how other states define family and things like that, because there's a pretty big range. And from my perspective, I think making that as broad as possible is extremely important.
Agreed. And definitely, I think once we've gone through sort of like the personal narratives, if we have time, definitely would love to, if folks have things right off the bat that we want to jump into, would love to do that as well. Sarah, and then Drew Christopher.
Thank you, Senator Daughtry. So I'm going to share my thoughts on the questions and try as much as possible to sort of tie it back to things that I think will be valuable for the group. So in terms of whether I've ever had access to paid family medical leave, I came really close at the start of the pandemic when the federal government actually did pass some paid leave for reasons connected to COVID-19. I have twins. They're now in first grade. And so there were some provisions around being able to take paid leave because schools closed. But I actually didn't meet the criteria because there was another caregiver in the home who could be with them, keep them safe. And there was a provision in the law that said, well, that means that you can't take this leave. So it was a provision of the law that really took away the ability for a family to make decisions about what works for them. It's also, I think there's also it's not a limitation that can be legislated around necessarily, but even if I had been able to be approved for that paid federal leave, it was the first time that the federal government had passed any paid leave. That's what I do for work. It's like, this is what we trained for. Like I could, there's the cultural, can you take time away from your job when things are really, really busy? So that's that first question. And then in terms of when would this have made a huge difference? So when I became a parent, I was working for a different employer. I did not give birth. I was a foster parent and now I'm an adoptive parent. That's a huge thing to keep in mind. I think there are a lot of, not so much at the legislative level, but at the corporate level, there are, it's much more likely that adoptive parents be afforded leave and foster parents sometimes are not. And that's something to keep in mind in terms of life happens and you have to be away from work. So that's something to keep in mind. But when I became a parent, and I had two very, very, very small, high needs infants to take care of. I fortunately had saved, I'm going to talk about this situation with the caveat that I'm very, very, very lucky. I was able to save up a lot of PTO. So I was able to take several weeks paid. And then I also had an employer, and more specifically a supervisor, who was very flexible and understood the complexity of the situation and let me, when my PTO ran out, I was able to come back one day a week and work remotely one day a week. And the reason why that's important is that allowed me to earn enough money to pay for my health insurance. So if I had just taken unpaid time after that, I would have had to write a check to my employer to stay covered for my insurance. So I think that's important to keep in mind. And also, in terms of the compliance landscape for leave of absence right now, a lot of times the discretion around whether a person is able to come back part-time or come back and take their bonding time with a new child intermittently is up to the employer. So it would be great if we could sort of make that consistent across the board. Something to keep in mind there as well. Hopefully that was helpful.
That was very helpful. Thank you, Sarah. Drew Christopher.
Yeah, thank you. I have just a few thoughts on like a couple of different situations that I've been thinking about kind of preparing for this meeting. And I think, you know, one of the things, like the two things that you'll hear a lot from me are, you know, how are we making this truly universal in a way that is actually helpful for low wage workers is thing one. And thing two is definitely going to be about how are we thinking about family and making sure that that really actually meets all of the kinds of family that we have. And I'll just say I have a friend right now who is fortunate enough to work a low wage job where there's private temporary disability. She broke her leg and will be out of work. It's been 6 weeks and it will probably be at least another 6. And she is the primary wage earner in her household. Her partner's on disability and they are trying to stay in housing in Portland, Maine, in which basically half of her income every month goes to rent. So, you know, they're going to be able to skirt through just barely because her wages are getting covered by 85%, at least for these first 6 weeks. But it's really scary. And I think, you know, for low wage workers, like any tiny bit of lost wages can really like ruin the balance in a household. And in a situation like things are in the housing market in Portland right now, like really can quickly lead to homelessness. And so I know a lot of people face that, and I just want to raise up that story as one. And then from my own personal life experience, I've had a couple of things. I got diagnosed with Meniere's disease about 8 weeks into the pandemic, which is a vertigo situation that's terrible. And, you know, got completely floored. I was working, at the beginning of the pandemic, doing worker rights stuff. I was working all of the time and I just got knocked out. And for months I was working part-time. I was in and out. I ended up taking 6 weeks of leave. We don't have paid leave because we need a system that helps us pay for it, right? At my organization. And I had enough vacation time and sick time, fortunately, to be able to cover that, and an organization that was really committed to making it work. But you know, it's not something that I'd never had a job that provided any leave like that before, never mind even vacation really. So even thinking about that as an option is something that was sort of new to me. And it can just like happen to anyone out of nowhere, you know? And the last thing that I just wanted to share is that I had an experience about 2 years ago of caring for a very dear friend who was very sick with complications of longstanding HIV and also cancer. And he is a queer elder in my community and a person who, like many queer elders, did not have strong relationships with his family of origin, and was a very important person in my life. And I ended up in a situation where myself and a friend of mine became his primary caretakers. We were medically responsible for him. We were at all of his doctor's appointments. We were at different points in and out of the emergency room at all kinds of days and night, and eventually supported him getting into a decision about end of life stuff and into hospice care. And then, you know, at his nursing home almost every day, tending to him. And, you know, it never really occurred to me that paid leave was something that I deserved in that moment or had an option for. But it would have helped all of us probably if I'd been able to take some time. But I think the most important part of that story is that, you know, my responsibilities to him were the same as any other kind of family. Yeah, and so I think protecting families like mine in this kind of situation and like that feels really important to me. And I don't know that we always see that people are doing this kind of labor for loved ones or recognize them culturally as being the same as other kinds of family. But I really hope that we can come away with this with an understanding that relationship is just as important as other kinds of relationships. So thank you.
Thank you, Drew Christopher. Thank you for sharing that. And thank you for all of your work. That's a really difficult process to go through. And it reminds me, I'll try to get a copy of the article to send to everyone about sort of the invisible workers of folks who do sort of the end of life care, whether it's, a primary caretaker, a loved one, extended family member, and how often that work is not seen and how it's often, as you're saying, not covered. And it's definitely with an older demographic in Maine, it's something that definitely we need to make sure that we're, covering our community folks, as well as, keeping in mind that, it's this policy can cover the full gamut of life, from the happiest moment of welcoming a loved one to, the tragic circumstances of getting ill and end of life care as well. So thank you. Would anyone else like to, Ms. Usher?
Hi, yeah, I'm not going to relate a personal situation, but I've worked with the elderly for the last 6 years, and it's always the same story. It's always a problem. Fortunately, with the clientele that I work with, they most usually can afford to have care come in. My concern is the acceptability. Even if someone has the money or the ability to do that, lots of times without a program, it's not acceptable to other employees or employers. So someone might have that money that they can take the time off, but yet when they go back, there's still a stigma of, oh, you were able to do this. So I think it's important that we establish a program for more than one reason, not just the financial piece, but also the acceptability of people being able to do these things. And on the other hand, I see people, I hate to say it, but probably at least once a week with Alzheimer's that need to go into a facility because nobody can take time off to do that. My concern is how to pay for the program and how we can be innovative and make this work. So that's all I would have to add to that.
Thank you. And thank you for your personal experience on that as well. Barbara?
Okay, well, first of all, I really enjoyed this conversation, and I think you're getting some of the answers to your third question as we listen to this conversation, because we're clearly hearing, and I think we have a group that has all spoken in terms of equity, in terms of how whatever this program is, however we create a program, it has to be created in a way that it can go from the hourly and part-time workers up through the professionals and in different realms. So I'm really happy to hear that. So I told you I'm a pediatrician. My own personal thing is my own kids were born back in the 80s. I didn't have paid or medical leave. And at the time I was a major earner. So I actually had to return to work more for financial reasons than any others. I'm actually remembering even back then I was covering an emergency room, and my husband brought my daughter in, and the nurse in front said, well, what's her problem? And he said, she's hungry. So it was more that I just had to feed her. So there were moments like that. But probably more importantly, as a pediatrician, I have worked with thousands of families who were trying to figure out how to nurture their newborns, take care of their sick kids, many of whom had long-term sicknesses of cystic fibrosis or MS or other diagnoses. And the systems, our systems and our society failed them too often. So, one of the things I think this group clearly believes, but we need to be stating at some point, is the value that we have on family and the importance of family in the largest definition of that word. And I do agree with Drew Christopher that we need to make a large definition of family. And I also want to I certainly want to speak up for the first 3 years of life. Whatever we can do to support the caregivers of those first 3 years will make a huge difference in the well-being of those individuals for their lifetime. And finally, I've only learned in the last couple of days that I was going to be on this group, but I will do some more work in terms of looking at what's the impact for women, for mothers and fathers about having this opportunity. And some of that may be in the links that Colleen provided, but I'll do some more work on that. So happy to be here. Important that Maine come forward and really value the work of caregivers and support families, young people, and mothers and fathers. So thanks for having me.
Thank you so much. I'm trying to think, has anyone not gone yet? I know Representative Stearns had to leave due to a prior commitment. Senator Rosen, I don't know if you're there, if you would be comfortable or willing to share your experiences. You're on mute, hold on.
I am here, but my story is very boring because I've been very lucky. I was manager for a big company in my 20s when I had both my children. So I was able to do the 6 weeks, had a cesarean with each, and was able to stay home with the kids. And then I was self-employed, and my husband and I were self-employed, had a clothing store. So I've been lucky throughout my life, being self-employed too, that we've been able to help other people. And at the clothing store that was in my husband's family for 105 years, we finally had to close it. We've been fortunate that we've been able to help people. But I've heard many, many stories from many people. Being in the legislature for 16 years, I've heard many stories, as you know, and heartbreaking stories, especially when the pandemic started. Our own daughter and husband live in Virginia with my 2 grandchildren. And my daughter's a hairdresser, he's a firefighter. So when the pandemic started, she couldn't work for a while and had to homeschool the kids like everyone else. But we were in a good position that we could help them, and her husband had a good job, so he could still work until he got COVID. So, it's just some days I take my bulldog for a walk, and you just have to breathe. And because you get so many calls as a legislator and trying to help everyone, and listening to the stories of what they're going through, and it becomes overwhelming. So I think this is a really good start. I'm very excited to be on this and to continue to help people, I hope. But thank you very much.
Thank you so much, Senator. And that is a good reminder that I think sometimes as legislators, we forget of sort of and anyone who's in a sort of caretaker position or someone who's receiving those stories, that, oftentimes I know many of us wish we had a magic wand to be able to help everyone. And that the pandemic really has brought a lot of those stories to the forefront. And I think one thing listening to everyone's stories that sort of comes back is just a reminder of how Mainers really try to take care of other Mainers and the incredible communities of support. And, how do we build off of that and make it, an official program that really, really, can meet the needs of our diverse populations. So thank you. I think we've all sort of discussed, have we had access and what the experience was like. I don't know, looking at the time, we're cruising right along at, almost 10:30. If anyone has anything off the top of their head, they're like, what, on the last question of, here's what I'd really like to see, no matter what, if they'd like to jump in. And yes, Sarah.
Thank you. So one thing that I wanted to make sure we spend a couple moments on, and I think it was Dr. Crowley that mentioned this sort of back around 9:15 or 9:30, simplicity. I think it's very important to keep simplicity as a central theme in what we're talking about, both in terms of the ability for people to understand what might become available to them. As we talk about what this might look like, I think simplicity is a very, very important touch point.
Thank you, and agreed. Not to pick on any other programs, but one of my other passions is student debt relief. And whenever I have a constituent call, looking for advice on how to navigate the Maine opportunity tax credit, you can just see everyone's head start spinning. So I can say from working in that field, the more simple and accessible we can make things is definitely a very important first value. So anyone else like to jump in? Emily?
Yeah, so I think I'd like to just reiterate that I think the program should be as broad as possible in terms of the definition of family, which we've already touched upon. But I think it also needs to cover a wide range of circumstances. So, bonding with a new child, becoming ill, or a family member becoming ill, but also safe leave for escaping a domestic violence situation, or leave around a military deployment, and potentially even bereavement. I think that it's really important to make access really broad. And I also want to reiterate that I think making it accessible means pretty much full wage replacement for low wage workers. So I think it needs to be on a potentially maybe a sliding scale, but low wage workers need their full wages in order to survive, because whenever a circumstance like this comes up, from my own personal experience, from experiences I've seen from other people, you also have additional expenses. So you're not only like struggling to pay your rent and your normal bills, but you have either medical bills or travel expenses or other things that come up and are hard to afford. And that's just compounded for lower wage workers. And, I think having it be really just as broad and accessible as possible also means making it available to people who are self-employed and people who are, not necessarily employees, because Maine has a huge, workforce of self-employed people. And working in the construction industry, I myself am self-employed, but, we have plumbers and electricians and all these other people who are also self-employed. So those folks need to have a path to access this same benefit as well.
Agreed. That's one of my foundation. I mean, obviously as a self-employed person, this is something that's near and dear to myself, but, seeing, Representative McDonald has a really great story. She works as a lobster woman and talks about, when her twins were born, just a reminder of, because of who we are as an economy, you need to have a pretty diverse range of, what it means to be covered and who can opt in and what a worker in reality looks like. So Wendy and then Drew Christopher.
Thank you. First of all, I would say I agree with the comments that have been made so far. And I do think that for a person going through either a crisis or a person who's about to have a child, either of those situations, to make it as easy for the person who's going to benefit from the program is very important. Also, as an employer, I have experienced many, many times over my long career with LL Bean, receiving new legislation from either the federal or state government where the instructions are so lengthy and complex. I think the federal I-9 is one of my favorite examples, where I believe it's an 81-page booklet that explains how to fill out a 2-page form. We should not be that. So I hope that we don't get to that. So in addition to simplicity, a few things that I had jotted down in my preparation were to have a high percentage of wage covered, particularly for people at the lower end of the spectrum. I think we need to have a reasonable length of the duration. A lot of states are doing 12 weeks, which seems to be in keeping, obviously, with FMLA job protection. Also, I think it's really important for us to pay attention to the technology to support this. As we know, we really need to invest in the automation upfront to reduce the human error and to reduce our need to hire 100+ employees to support this at the state level. So I think that choosing the right vendor and ongoing vendor support partner will be really important for the state to make sure that this runs smoothly. So those are some of the things that I had noted.
Thank you. And gave me a good chuckle on the I-9 one. Absolutely.
You've seen the booklet.
Oh, yes. True, Christopher?
Yeah, I'm really appreciating what all of you are bringing, and excited to hear a lot of the ideas that are in the room. I think one thing that I just wanted to name, and we learned, so the Southern Maine Worker Center worked a lot on policy around paid sick days, particularly in the ordinance in Portland, and through the conversations with our members, really kind of dug in around sort of how do we make policy universal, and just some things that I think were trip ups for policymakers around things that I think are worth just flagging is temporary workers, per diem workers, and part-time workers. And just to name, like, I think that a lot of people have an impression of like per diem or temp workers as being people who aren't working full-time, people who aren't working at the same business for long periods of time. And actually in our current economy, you know, temp workers may be working for years and years and years, the same hours at the same business, right? And per diem workers might be working 40 hours or more a week at the same place. And so making sure that we have mechanisms to make sure that those folks and also part-time workers are eligible and included in a policy that makes sense for them, because they're doing the same kinds of jobs as full-time or permanent workers might be. And just also to name, like, I think when we think about sort of people who work for themselves, a lot of times that we're thinking about people who are independent contractors. And also in our current economy, there are a lot of people who are misclassified. I worked as a misclassified worker in the construction trades for a number of years and didn't get the benefits that I should have been getting, including unemployment and workplace safety stuff. So, and also that, you know, we live in a world where people who drive for Lyft and Uber are considered like independent contractors, right? So just making sure that we're like have an idea about those kinds of folks too.
Thank you. Reminder. Also, because a lot of primary caretakers end up having to be on those misclassified, you know, elements or, you know, part-time work to be able to afford to be able to be a primary caretaker as well.
Yeah, exactly.
Representative Cloutier?
Thank you, Senator Daughtry. I was just wondering if Drew Christopher could define what they mean when they say misclassified worker.
Yeah, totally. I'm sorry I didn't sort of say that.
No worries.
So misclassified workers are basically people who technically meet the definition of employee, but are being paid and treated by their employer as an independent contractor. And my experience with that is in the construction trade. So you work for the same construction company, you go out there every day, they tell you what to do, you know, you're basically an employee, but they say you're an independent contractor, and it's a way of getting around having to pay employer side taxes and that kind of thing. So
great, thank you.
Any other sort of top line thoughts or messages of what you'd like to see if we were waving our magic wand? Emily?
One thing that I forgot to mention that I think is pretty important is that this is a public program. I think it's really, in terms of management and access, that's going to be critical that it's run by a public entity.
Agreed. And I think that gets back to if we're thinking of the core values about accessibility and how is it most simple, to come back to that one as well, and, you know, able to access this program. One thing I would sort of say and sort of, you know, put the challenge out to not only the members of the commission who are business owners or work for larger employers, and also to anyone who's listening, is how, and would love to also sort of talk to and get information from the other states. The balance between existing employers who offer leave programs and sort of the symbiotic relationship that can be used to either, supplement these programs, or, what would be helpful for someone trying to use this as a recruitment technique or something that would really, make it easier to improve their workforce as well. That's one of the things that I don't have the exact answer, but I know, we have a really incredible amount of small businesses. We also have large employers. We also have self-employed people. We have, gig workers and misclassified workers. But how do we make sure that, we are keeping to those root values of keeping it simple and accessible, but what would be the best way to serve all of those populations? Barbara?
I just want to second what you're saying, Senator Duddy. When I went to the CEO of Maine General to say, I've been asked to be on this commission, and we do now, it took a painfully long time. We do now have a paid maternity, paternity leave, but there's still so much more that we could do. But one of the things he clearly said, and I think we need to be emphasizing, is given the labor issues right now, what the role of paid and family medical leave. I mean, Senator, you mentioned it when you talked about your classmates from the Brunswick High School aren't coming back to Maine because they're getting offered these, but we have to somehow highlight that somewhere so that both small and large employers know the value of this. But honestly, that's exactly what the CEO is thinking about. Given how hard the labor market's going to be right now, it's going to be important to emphasize this. So thanks for that.
Thank you for sharing that. Sarah?
Thank you. Just to follow up on that comment, I think there's the component of folks deciding where they want to live and when they want to start a family, but then there are also, I mean, you're in a car accident or what have you, those things are going to happen either way. And so whether there's paid leave or not is really going to determine whether that person has to quit their job, is going to come back to work, is going to, experience homelessness. So I think that's important to keep in mind as well.
Thank you. I think it, reminds me of a sticker I have in my office that says "Life happens." A good value to remember.
And it will continue to.
No matter who you are, no matter where you are.
Sorry, did you just say me? Yeah. Great. Yeah. I just wanted to name a couple other things, and that just, Sarah, what you just said reminded me of that. I think just making sure that folks have guaranteed to be able to return to their jobs, and also like strong enforcement mechanisms. I think there are people who will want to force out workers who have been sick or injured from working where they currently work. And so making sure that their jobs are protected when they come back, and also that people aren't retaliated against for asking to use these benefits. And that's something that we see sometimes too, is that when you ask to have your rights respected in the workplace, that some employers some of the time retaliate against workers. And so just making sure that there's some mechanisms to protect folks from that.
Thank you. It's an important reminder. And I think another value word I throw out is universality. And that if it's something that everyone can access, and that's something, no matter what industry you're in, and no matter what your dreams are, like if your neighbor has the same access to the program as you do, it really sort of cuts down on a lot of that sort of pushback and stigmatization for being able to take this leave. So I think universality is definitely another word to throw out there. Sarah?
Thank you. Just super quickly, in terms of, Drew Christopher, I share your concerns around retaliation and job protection. In terms of simplicity, from my experience watching how other states have handled this, it seems as though the states that offer a wage replacement program for paid family and medical leave and then keep the job protection separate, that appears to be working relatively well. I've seen a couple of situations where the concepts are sort of smushed into one law and it becomes pretty confusing, a little bit difficult to operationalize. Connecticut is getting ready for their program to go live this January 1st. And while the law around their paid leave benefits is separate from their job protection law, which had been existing, while those are separate, they made a lot of very significant changes to their job protection legislation effective 1/1 of 2022. So the conversations are getting very, very messy and very confusing. So that's something to keep in mind as well.
Thank you. That's a very important reminder. Any other sort of top line values, Anita?
I just, I agree with a lot of what's being said here. However, my concern is the financial piece, employer versus employee. And the lady from LLB, and I'm sorry, I've forgotten her name already. Maybe you can help me. But anyway, I'd like to know, she said she had 19 states that LLB are in right now, and how that's working and how that's processing, one. Two is, the study that will be done, does that cover some of the payment and how the other states are doing it, or how they would suggest that we do it? I'm just a little antsy on that piece.
I'll jump in on that and then pass it over to Wendy to sort of answer the bit about, Ella Bean from sort of like the 30,000 foot level. The point of having the actuarial study is exactly because of those current concerns of what will this financially cost. Having introduced several different pieces of paid family medical leave, ranging from a TDI system to, pie in the sky, what became very clear is you can't just pull a number out of a hat. This has to be something that's done deliberatively, carefully, with public input from everyone, from employers to employees. And the whole idea is having the actuarial study to figure out what those financials are. And it's something, none of us necessarily, we can have our own ideas and we can, ask folks like the commissioner to sort of estimate what it would cost for, IT, but until we have that concrete roadmap, it's almost, I think of it, writing your business plan. What are we looking at? What do we have to tweak? What's unattainable? And what really has to be the concrete guardrails to be able to achieve these goals that we'll be discussing over the next few meetings. So I don't know, Wendy, if you want to jump in from the
Just to clarify my comment earlier. So currently we do operate in 19 states. 3 of the states currently have paid leave that we administer. So that's New York, New Jersey, Massachusetts, and now Connecticut will be going live. So all of those in our materials that you sent out, there are the summaries in there about what each of those states do, but it is paid for through a tax that comes out of employees' pay every week. And it's a very small amount. And when we get into the details, I'd be happy to share more about the details behind the scenes at LLB and as those are appropriate.
That'd be great. Thank you. And I think just to remind folks not to use all the school metaphors, but I think everyone's homework is, if you get a chance to really dig into the amazing resources that Colleen and Anna put together to look at the other states, they really range. Some states are opt-in, some are opt-out, some have a diverse marketplace. There is a lot of information out there. And I think it's a really great opportunity for us to sort of look at what might work, knowing not only our demographics, but also what, our state government looks like, and really figuring out how those work, how it gets paid for, what's the match look like, what's the mechanism to get the fund to be vested. So that's if everyone can take a brief look at that before our next meeting, it'll be really, really beneficial. And if anyone has any other resources on that on the other states, feel free to share those with us as well. Any other thoughts, values? I'll say one thing for me, thinking of the cost and, looking at all the different managements of it is really how to make it something, we're coming out of a pandemic that's been incredibly hard on employees and employers. And, we're at that unfortunate area where we need it more than ever, but how do we make it so that we have a robust system that can meet these goals? And also how do we make sure that it's viable? So I think that's one of the things that, the actuarial study will help us with as well. Not seeing any hands going up. Trying to think. Representative Cloutier, do you have anything you want to add in there? Or?
I mean, I would just echo everything that we've heard. I've kind of tried to sit back and keep my own mouth closed to sort of hear the input of everybody else on the commission. And it really just echoes kind of all of my own sort of internal thoughts and feelings on it. So I really appreciate everyone sharing their personal stories earlier and having put so much thought into this before coming to this first meeting.
Agreed. And one of the things to sort of help us navigate this process is, you know, for your own thoughts when we're going through these and when you're reading materials, one of the things I always do is, you know, sort of keep my notebook by me with sort of like the top line messages to sort of keep yourself focused and really urge all of the commissioners to think about those big questions we need to have answered. And, you know, especially when we get down in the weeds, it can be very easy to sort of get off course. But as long as, you know, you sort of have your matrix to sort of keep coming back to that, you know, simplicity and, you know, accessibility and those sort of ideas, you know, keep that list going and also use it to generate what we can bring you for more information and what we really need to look into more. Barbara?
What you're reminding me of, there was a mention, I think Senator, you made it, to the unseen workforce. And it may be in the materials that you sent, because I haven't looked at it all. But to look at what are the demographics of Maine and, you know, how many, what do families look like in Maine? What can we say about that? How many are two income working families? Because a lot of the need for paid family and medical leave is because of our changing culture, where most, it came out in your stories, most of you have two working people and not a lot of room to do that kind of sharing. So, and you've also said Maine is different than Washington. Well, it would be helpful as we go along to characterize that more. How are we different? It probably has to do with both the employer landscape, the family landscape. We're going to have a lot more people in my category aging with dementia issues, those sorts of things. So that as sort of background for all of us would probably be helpful.
Thank you. And I don't know, Commissioner, not to ask you for an assignment right off the bat, but maybe one of the things we could do for a future presentation is really looking at what the demographics of Maine's workforce are. And I know this is something that your department is difficult, especially during the pandemic with unemployment and capturing, you know, those who are lost workers, but maybe looking, you know, having that framework for us to have the demographics of what it looks like from an employee perspective might be useful.
We can provide some of that information. I would also say that probably Amanda Rector, as the state economist, would be a good resource as well.
Thank you. That would be a really great presentation. That's a good reminder.
I'll say one more thing, because I was on the Economic Recovery Committee for the governor, and we were being presented some of that. So I'll go back and look at some of that, but I think some of what I've just been asking about may also be in that, some of the materials there. So I'll go look at that as well.
And please, if anyone does have materials they come across that you think would be very helpful, you know, please send that to, you know, ourselves and Colleen and Anna so we can make sure that we distribute it to everyone. Any other top line comments or thoughts? Not seeing any hands go. Oh, Emily.
One thing I just want to mention really quickly about just thinking about, you know, costs and funding. I think it's important to keep in mind as we go forward that lots of places around, you know, all over the world offer this type of benefit and probably offer it in a much more robust way than we're even talking about here. So there, you know, my husband's actually Canadian, and you know, we have friends and family there who have access to a full year of leave after having a child, both, you know, any parent. So I think it's just, I think we, you know, keeping in mind that it's absolutely doable, especially given the many examples that we have to follow.
Agreed. Thank you so much. One thing I was just thinking of, which is not on the agenda, but I think perhaps before we jump into discussing our possible future meetings, I don't know, Colleen or Anna, would it be possible for one of you to screen share and highlight the commission website, just not only for the commission members, but for anyone who's watching on YouTube?
Oh, definitely. Hold on 1 second. Let me see if I can do that. I can do that. Quickly.
Perfect.
Here you go. So I think everybody can see this. So we have set up a website for the commission. We've sent out the links and we have information there for interested parties to sign up. The membership list is there, and we'll add the presentations from today. So we put up all the information we shared with you ahead of the meeting. We have also, which I forgot to mention, you did receive a letter as a commission from Unum. We shared that with you. And as we continue to, we've asked for written public comment from folks. We'll continue to share that with you, add that to the website as well, and put any additional resources and links from some of the slides. We'll put it up on the webpage. But hopefully everybody, I have it bookmarked. Everybody can now bookmark it on their web browser, and that's where we'll be posting things as we move forward, both for commission members and for the public.
Thank you, Colleen. And it'll be a great resource for all of us moving forward. So thank you. With that, I mean, I know we're coming up on 11, and the best news anyone can get on a Friday is that a meeting is going to be done early and we all get an hour of our lives. Just sort of wanted to discuss about possible future meetings and how to go about that with everyone's availability. Representative Cloutier, you and I didn't really get a chance to discuss maybe next best steps. I don't know if we should do a doodle or if anyone has any, like, it absolutely cannot be on these type of days. I think we are going to try to jump in pretty quickly, looking at the timeline to get as much done as possible. But yeah, I just wondering if anyone has any absolutely cannot do X, Y, and Z.
I guess I'm just wondering, before we even talk about days, like, does this time of day work for most folks? Okay. And does the Zoom format work better for folks than trying to meet in person? I think your chairs think it does, but I'm interested in what other folks think.
I'm seeing nodding heads.
Okay, good. All right, cool. Because I know that, I also have, family kind of obligations. So the Zoom format is much easier to manage all of the various things.
We were not joking, quite seriously discussing that being on Zoom is better, especially not only for this topic, but for those of us who have businesses and family members and loved ones and children, that Zoom makes it more accessible. And then does this time of day work for folks? So the 9 to noon? And then we will be adjusting as possible. Oh, puppy dog. Oh, Senator Rosen, your bulldog is absolutely gorgeous.
This time works for George.
Perfect. Thank you, George. I actually have my puppies being dog sat right now by my family. So they will probably be making later appearances at some commission meetings as well. So I think maybe, it does this time on Fridays it seemed to work for everyone, which seems pretty rare, I have to say, from the world of meeting organization, that everyone, I'm seeing a shaking from Bonita. Okay. I'm thinking.
Is it the Friday piece that doesn't work?
Yeah, it's the Friday morning. I have a client Friday morning that I need to be with.
And Drew Christopher, it looked like you might have issues with Friday mornings too.
Yeah, I have a regular standing appointment on Friday mornings.
Okay.
For me, it's Monday or Wednesdays. So I don't know. And, there's a possibility it's just not going to work for everyone all the time as well.
Agreed. I think maybe we could send out a doodle of whether Mondays or Wednesdays work best for folks. We could just rate the days of the week and see which, but we'll say we'll keep this 9 to 12 slot. So keeping the mornings, and then see which morning of the week, and completely understand, as we said, life happens, schedules shift, and, just let us know. And a lot will also be dependent on presenters and availability as well.
So Senator Daughtry, one question that I have is, so we've got 6 meetings. 1 down, 5 to go. And I think are we trying to get through this piece by January and then putting the actuarial study into play then to try and meet the February deadline? So I'm just thinking about, we've got November and December. So we're thinking maybe 3 meetings in November and 2 in December.
That would be,
and you and I haven't talked about this.
Yeah, no worries. I would say that would sort of be our rough goal. And just to let everyone know, if you look at the authorizing legislation, we're currently authorized for 6 meetings by the Legislative Council, but we are also aware that sometimes work takes longer. The biggest thing is to do a well thought out policy. So if we need more time or additional staffing, as Colleen and Anna said, OPLA cannot staff this after session starts. So we have to be mindful of that, but we do have permission to seek outside staffing and work with other, departments and staff. The biggest thing is to make sure that we're getting the information we need. So moving forward, I would say, roughly look at like about 3 meetings in November and 2 in December. And then at that point, evaluate whether we need more time, if there's still large unanswered questions, and adjust from there. Barbara?
When you were first presenting, actually, I guess it was Anna was first presenting, and I was thinking, okay, we got to get this done by February 1st. So I was kind of charting out a little timeline thinking, this is really tight. The one thing I would want us to have some understanding of is somebody talking to an actuary about how long it would take once they receive the information. And obviously it's going to depend upon how complicated the information is, but we need some ballpark, and I don't think a month. If you get it to them by January 1st, and I'm not sure a month is long enough for them, and then we're hitting the February 1st deadline. So I agree with you about 3 meetings in November and 2 in December, but I almost think that by mid-December, before we hit the holiday season, we're going to need to at least have a framework that we're showing to an actuary. But somebody should talk to an actuary to see, is that right?
And we also have to do the consideration of the RFP process, which we will try to, the chairs will meet with OPLA within the authorizing legislation, what that RFP and the next steps would look like, so that we can all deliberate on that as these conversations are ongoing, because you have literally hit on the one thing that I am the most nervous about with the timeline. So Commissioner Fortman, did you have your hand up?
Well, I think it's similar to what Dr. Crowley was saying. It's how much of the framework of the proposal needs to be together that then the actuary is going to cost out, or are there multiple proposals that then the actuary would evaluate that would inform decision making? I guess that's the part that I'm struggling with.
Agreed. And don't have the answer. I think we're all going to be filling out that answer as well.
But I think that, as you stated, Senator Daughtry, there's a possibility for us to get an extension beyond February if we need it. So while I think we need to feel a little bit nervous about it, it's not a sort of end of the world situation. Correct?
I would say so. I always believe, and I think it especially helps in a legislative perspective where we have a deadline to hold everyone's feet to the fire, but also, things don't get built in a day. So aim for the framework we have laid out, ahead of us, and be full steam ahead and see where we go and assess from there.
Agreed. Thanks.
So I'm trying to think. So we'll send out a doodle figuring out which day is the best morning slot for everyone. Colleen and Anna and Representative Cloutier, please let me know if I'm missing anything that we had to go over. I'm trying to think. I feel like we had a pretty light agenda, so I feel like we've actually checked off everything. I'm seeing nodding heads, which is always.
I think so. Yeah, I think so. Unless there's to some extent you want to talk about what you might want the agenda for your next meeting to be as a group. I mean, we can certainly, I think we'll certainly meet with the chairs after to kind of flesh out that agenda, but if there are any particular important things that other commission members would like to see at the next meeting, it might make sense to talk a few minutes about that.
Thank you, Colleen. That's an important reminder. So actually, yeah, that's a great opportunity. We had some requests about demographics in other states, the demographics of Maine workforce. I would just open the floor to any requests.
One thing I would say is you've given us some homework in terms of going through the materials that you've already sent out. I would like us to begin to think about what a framework might look like, even at the next meeting. So I would ask all of us, as we're looking at the materials you've sent out, what of those different programs would you like to have included in a framework, and begin to have us do that? Now, I do think that you as the chairs and the two staff people are probably going to have to structure that framework for us to hang our pieces on. But we could at least begin to say, and we've already been telling you what really is going to matter to us. I would like if we're going to get there, and this is going to take us longer than we think, is my opinion, but I agree with having the deadline. I agree with the representative about having the deadline, but I also, and Representative Stearns talks to this, is that we ought to do this right. And if it takes us some more time, it's too important. So I guess I would ask all of us to look at the materials and think about what's important to us in the framework.
Agreed. Sarah?
Thank you. I would say, in addition to the demographics information, so we can compare across states, we touched on this a little bit earlier when we were talking about Washington, but to the extent we can get data around usage rates in other states, so we can be comparing across different state programs, specifically in terms of the characteristics of those programs. I'm thinking of, for example, the states that define family members broadly versus the states that are more constrictive about that. Does that have an impact on usage, that sort of thing, so that then we can at least have a beginning of an understanding of how those levers might impact an actuarial study and, financial solvency and all of that.
Agreed. That would be really, really great. Real quick, Emily, I will go to you in just a second. I just wanted to see if I can actually share my screen real quick about the framework and how to think of it. I know not everyone, Zoom will not let me share my screen. So I don't know, Colleen or Anna, could one of you just throw up the Better Balance framework real quick? Let's see if this works. Perfect, thank you. So just to highlight for folks, I know because it was so quick, not everyone has had a chance to look at this, but this is a really great starting tool and a starting matrix as you're sort of meeting the challenge that Dr. Crowley just highlighted. It goes through, I've been, using a different updated version of this through all the years to see how it changes of, what purposes, and you can see, it's 14 pages long and it goes over, who is covered, what are the parameters, what's the cost, what's the contribution, what's the limit. So I think to sort of highlight that and make sure that's one of those things to maybe print out and keep with you at all meetings. And then Emily?
I just think one thing that might be helpful to understand the next time around is the process for the study. So, our kind of like timeline, what we need to provide when, and come up with that, because that seems like a pretty big unknown and it might help direct our work. Yeah.
Agreed. We'll dig into that as chairs and as staff to report back as well. Drew Christopher? Excuse me.
Yeah, just seconding that comment. This is my first time through one of these things, so a little bit of a sketch of what the process looks like and what needs to be part of that and what the study will be like would be helpful for me to orient around this. And then also, I think my understanding is there's going to be a place where we're going to have public comment on our work. And so just kind of curious about where and when that fits in and how we communicate that out to folks.
Absolutely. I'll just take a quick stab at this. As co-chairs, we've been trying to figure out that mechanism and how to work it into meetings. One of the things that we're looking at on that website is to be able to have a public comment period. So no matter, say someone knows the work is going on and wants to either share their own story or share their concerns, that we can be accepting that public comment at any time of day, anywhere, and then also working on the mechanism to be contributing and soliciting that public feedback within our meetings as well. And then one of the things that we're also trying to figure out for the commission is, once we have those frameworks that we're discussing, how do we have that public process like we do for normal pieces of legislation, and how to make that work? It's not exactly clear cut is my answer, but we're trying to do as much as we can, because that's key to this. It's got to be public input. It's got to be, checking in with everyone from, Wallagrass to Lubec to Kittery. Like, we need to be getting that feedback.
Great. I'll just add that because I'm always wearing an organizer hat, and so from my perspective, having a space where people really clearly know this is the day and this is the time for people who are going to be impacted by this to come and make comments is great. But thank you.
Agreed. And that's one of the. Oh, go.
I just wanted to jump in. So I think our plan, once we get the dates for the meetings figured out, is to get those posted on the website so that folks know when they're happening. And then for us to allow like a normal public comment period at each of those meetings for folks to weigh in on stuff that's on the agenda, but also to have the opportunity for folks to weigh in on stuff that may not be on the agenda on the website, and to give people the opportunity to provide kind of testimony or commentary in person, over the Zoom format, but also in written format if that's more comfortable for them.
Exactly. Thank you, Representative. And if anyone has any suggestions on soliciting that input, feel free to send those to us as well. Trying to figure out, like you're saying, how does it make it possible? And one of the things we've seen in committee processes, at least with the Zoom format, is it has enabled, Maine's a big state, and at least in education from our experience, oftentimes people can't afford to take a day off to go testify on a bill that applies to them and has an impact on them. So one of the things we're also committed to is having a diverse mechanism to get that input if people can't make it on that set day as well. Any other questions or requests for information? I would say, looking at the schedule, I think we might be taking a week off just to get us a chance to get our feet on the ground and get the information and feedback and set the agenda, but do plan on at least 3 meetings in November and 2 in December. And going to keep bringing it back to the school thing, but everyone, your homework, please dig in. And as you're going through it, please reach out. If you have any comments or questions, keep them coming. And with that, thank you all. I know how hard it is to give up a Friday morning. So thank you for your willingness to serve. The legislators on this know what it's like, but for those who, haven't done this before, this is, sort of new to you. This is one of the best forms of public service, but it also takes time and is a sacrifice on, your life, your family life, and your work. So thank you for being willing to take this on. And I am, to put it mildly, I'm wicked excited about this process, and I can't wait to really sink into it. So with that, thank you, everyone, and enjoy. I don't know, Representative Cloutier, do you have any last comments you want to throw in there?
No, I would just echo everything you just said. Thank you all so much for being here and sacrificing a lot of your time and energy to something that I think is really, really important for our state. So thanks.
Thank you.
Representative Stearns reminded me I didn't properly start this, so now we can say the meeting is adjourned. Have a great day, everybody.
You too, thanks.
Everyone.